Hello everyone. In this session, we'll continue with the next topic in lower limb anatomy, that is popliteal fossa. In the previous session, we had learnt about the gluteal region as well as back of the thigh. Okay, so this is the next topic to be learnt, and we'll cover it with the help of anatomy decoded notes. Okay, so let's start the topic. So popliteal fossa, where is it located? It is located at the back of the knee. Okay, it is a diamond shaped hollow which is present. Okay, it corresponds to the cubital fossa of the upper limb. Okay, in front of the elbow in the upper limb there is cubital fossa, and behind the knee in the lower limb there is a fossa called as popliteal fossa. Okay, then what are the boundaries of popliteal fossa? Since it is diamond shaped, it will have four boundaries, right? One boundary will be referred to as superomedial, one boundary will be referred to as superolateral, one boundary will be referred to as inferomedial, and one boundary will be referred to as inferolateral. Okay, so if this is the region of the right knee which you are looking from the posterior aspect, so these relations fit as if you are looking at the right knee from the posterior aspect. Okay, so what is the superomedial boundary? It is formed by semitendinosus as well as semimembranosus muscle. Okay, so look at this diagram, you can identify the semitendinosus muscle and the semimembranosus. Okay, both muscles are present along the medial aspect of the thigh. They are coming in the superomedial boundary. Then inferomedial boundary is formed by medial head of gastrocnemius muscle. Okay, so these are muscles of the leg, medial head of gastrocnemius. Okay, so this forms the inferomedial boundary. Then superolateral boundary, it is formed by biceps femoris muscle. Okay, in the thigh, the muscle which is lateral, that is biceps femoris. Okay, then inferolateral boundary is formed by lateral head of gastrocnemius along with one more muscle, that is plantaris. Okay, so two muscles are forming inferolateral boundary, lateral head of gastrocnemius and plantaris. Okay, and then when you're writing about the boundaries, make sure you write about the roof and the floor as well. Okay, many a time students just write about the side boundaries and they feel that boundaries heading is over, but it is not unless you cover the roof and the floor. Okay, roof of popliteal fossa is formed by skin, the superficial fascia and the deep fascia. Okay, in anatomy, when whichever is the region, these three headings would be common, but there would be something that would differentiate it from other regions, that is the contents of the superficial fascia. Okay, so superficial fascia containing the saphenous vein, the three cutaneous nerves. Okay, name of these three cutaneous nerves are, you can identify here in this image. Okay, at the center or in the middle, that is the posterior cutaneous nerve of the thigh. Medially there is posterior division of the medial cutaneous nerve of thigh, and laterally there is sural communicating nerve. Okay, so these three cutaneous nerves, saphenous vein, okay, and deep fascia here is also referred to as popliteal fascia. So all these structures form the roof of popliteal fossa. Then floor of popliteal fossa, it is formed by three structures from superior to inferior. Let's try to identify it in this diagram. Okay, so look at this diagram carefully. In the upper part there is popliteal surface of femur. Then there is the capsule of knee joint which is supplemented by the oblique popliteal ligament. Okay, so these two together we can remember. And there is the fascia covering popliteus muscle and the popliteus muscle itself. Okay, so all these structures are forming the floor of popliteal fossa. Okay, so that floor of popliteal fossa is mentioned here. Okay, then coming to the contents of the popliteal fossa. So as the name is popliteal fossa, there are artery and vein of the same name. Okay, there is popliteal artery and its branches, popliteal vein and its tributaries. Okay, and can you all think popliteal artery is a continuation of which artery? Yes, it is a continuation of femoral artery. Okay, so again let's look at the contents in this image. Okay, here we can see this artery is the popliteal artery. Okay, when the femoral artery crosses one muscle, the adductor magnus, there is an opening called as hiatus magnus. When it crosses the opening in that muscle, its name changes as the popliteal artery. Okay, similarly popliteal vein which is ascending up, it will change its name to the femoral vein when it goes to the region, the adductor canal. Okay. So popliteal artery and popliteal vein is there, but popliteal nerve is not there. Okay. So be careful while attempting the answer or speaking. The nerve here is tibial nerve and common peroneal nerve or the common fibular nerve. Okay, these two are the terminal branches of the sciatic nerve. Sciatic nerve is the nerve of the back of the thigh. It divides into two branches. Okay, medially there is tibial nerve, this one, and laterally there is common fibular nerve. Okay, so these three are the chief contents, and there are a few others that we'll see. Okay, so here we can see tibial nerve and the branches, common fibular nerve and the branches. There are some lymph nodes, popliteal lymph nodes, then popliteal pad of fat. Okay, and there is a specific set of relations of this artery, vein and nerve in the popliteal fossa. If you see the upper part of popliteal fossa, medial to lateral, the relation is artery, vein and nerve. Okay, we can identify this again in the diagram. Okay, just look at the upper part of popliteal fossa. Medial to lateral is artery, vein and nerve. Okay, and as we come to the lower part of popliteal fossa, the relationships is changing. Okay, so here artery is on the lateral aspect in the lower part, vein is in the middle and nerve is here. Okay, so in the lower part of popliteal fossa it is just reverse, nerve, vein and artery. Okay, and in the middle of the popliteal fossa the three structures are overlapping. The superficial most structure is the nerve, then there is vein, and the deepest structure would be the artery. Okay, in anatomical position, if we see, the anterior most structure is the artery. Okay, but while doing dissection the cadaver is in prone position, so we use the term the deepest structure is popliteal artery. But in anatomical position, if we say, we have to say anterior most structure is the popliteal artery. Okay, so these relations of the structures are mentioned here: relations in the upper part, relations in the middle part, relations in the lower part. Okay, so when you're writing about the contents, add a note of this also. Okay, and how to remember the in the upper part of popliteal fossa artery is medial most. You can remember by the continuity of that artery. Okay, it is a continuation of femoral artery. Femoral artery, it's present in the adductor canal, which is present along the medial aspect. Okay, so since femoral artery is on the medial aspect, the popliteal artery in the upper part is also on the medial aspect. Okay, so if you remember at least one relation, then you can think about it and write the reverse in the lower part of popliteal fossa. Okay, then coming to the applied anatomy of popliteal fossa, popliteal pulse can be palpated. For that, the knee has to be flexed and relaxed. Okay, then we have to place the fingertips of the hands in the popliteal fossa with the thumbs resting on the patient's patella. Okay, so this is how the popliteal pulse can be palpated. It is one of the difficult pulse to palpate amongst all other pulses. Okay, because popliteal artery is quite deep in this region. Okay, then there could be an aneurysm called as popliteal aneurysm. This we had seen in adductor canal applied anatomy as well. If there is an aneurysm in popliteal fossa, what is aneurysm? Basically, if this is the normal wall of an artery, if the wall of the artery gets dilated, okay, then that condition is referred to as aneurysm, in which the wall of the artery will get thinned out. Okay, so in such condition, there will be a pulsating midline swelling in the popliteal fossa, and surgical procedure for the correction of this is done in the adductor canal. Okay, the femoral artery has to be ligated in the adductor canal that we had seen in the adductor canal applied anatomy. Okay, then there could be a cyst in the region of popliteal fossa called as Baker's cyst. It is a cystic swelling which occurs in the popliteal fossa. It is actually an inflammation of the synovial bursa underneath the semimembranosus muscle. Okay, there is a bursa underneath the semimembranosus that can get inflamed, and this will present as a non-pulsatile swelling. Non-pulsatile means it will not beat along with the pulse. Okay, in popliteal aneurysm it is referred to as pulsatile. That means it beats along with the pulse. Okay, so that is how these two swellings can be differentiated. Okay, so all these were the applied anatomy in popliteal fossa. Okay, and this topic is a very important topic when you're learning lower limb anatomy. Make sure in and out about this topic. Okay, you may be asked about this topic in theory exams as well as in practical exams. Okay, but more frequently in theory exams. Okay, very frequently asked short note or a long question. Okay, make sure you cover all basic headings, its location, boundaries, contents, and the applied anatomy. Okay, and you all can buy these notes which we make from this QR code. Okay, and make sure you watch other sessions of this YouTube channel to get your concepts clear in anatomy. Thank you.